So today we are going to talk about cranial nerves, and as we can see that we have 12 cranial nerves, 12 pairs. In order to memorize 12 cranial nerves, you need to have polydactyly, so you need to use your fingers. So if you don't have 12 fingers, maybe you shouldn't be watching this video. But wait, before you turn it off, maybe what we can do is just deal with our 10 fingers, and then you can just memorize 10 nerves. And for the last two nerves, you can just tell your professor that you're sorry that you were at a disadvantage, so you didn't memorize the last two nerves. But I'm going to go ahead and make an attempt. So you can see I have 12 fingers. Well, two are hiding. So anyhow, so we're gonna go ahead and say each nerve is going to represent a finger. So cranial nerve number one is olfactory, and olfactory. In order to remember what does this do, you just pick up your finger and put it under your nose. All right, so that's what it does. It just gives you the sense of smell. And never test it. Actually, never do that. Yeah, it's a waste of time. Unless you have 1 hour to examine your patient and do a neurological physical exam, which that day will never come. You don't need to test for olfactory nerve. Cranial nerve number two is optic. So optic, stick 2 fingers, put it under your eye. So yeah, that's what it does. It gives you the vision. So what it does is it takes the sensation, the sensory input from all the surroundings, processes it inside the retina, and then sends the signals to the brain. And then we know, okay, at the back of the brain, we are a little bit more smart, and we can see pictures. So that's what the cranial number two or optic nerve does. Number three. So number three is oculomotor. So take 3 fingers and do like this. So that is your focus. See how with 3 fingers we are focusing? That really is what the cranial, what the oculomotor does. It just makes you focus. All right. So basically, what this means is that we have lots of muscles around the eyes. We have more muscles around the eyes than many other parts of the body. This is the purpose of that is just to be able to move your eyes into different directions and focus. So the focus will be oculomotor. There are only 2 muscles that are not supplied by oculomotor, and we'll talk about that next. All right, so the 4th nerve is trochlear. So trochlear is basically up there. So with 4, what you do is you go up like this, which means that you are moving up. So that is your superior oblique muscle of the eyes. It makes you move up, and when this nerve is paralyzed, you actually are going to keep your eyes up when it's paralyzed. The reason behind that is that superior oblique muscle actually is like a pulley, so it pulls the eye back and down, but because when this nerve is paralyzed, you're going to keep your eyes up. Of course, it doesn't happen very often. We'll talk about number 5, but let's talk about number 6. So number 6 is 3 and 3, right? Fingers. You just move them out, or maybe it's hard for me to do that, but anyway, move them out. Well, I'm still kind of cold. So, well, when you move them out, it's out. So what does the number 6 abducens do? Abducen is like abduct. So abduct means it's abducting. So it's moving our eyes out, and basically it's making the lateral rectus muscle of the eye work. So that's how we can look side to side. When this nerve is paralyzed, of course, the common sense would say our eye is going to be inward, right? So it will cause strabismus and all that. By the way, when the oculomotor nerve, which is the 3rd nerve, when this is paralyzed, our eye is going to be down and out. So if there is a question on your exam that the patient has a down and out eye, what is happening? Well, simply say it is the oculomotor nerve. Okay? All right. Let's now move on to 5th nerve, which is trigeminal. So trigeminal is a little bit tricky, and it's hard to remember. So how do we remember that? Okay, well, here, just pick up your hand and go like this. This, and this. All right. So what do? Well, I just made 3 motions. So this means that the 5th nerve has 3 branches. So this is ophthalmic branch, this is maxillary branch, and this is mandibular branch. So ophthalmic branch gives sensation to the superior part of the face up to the lateral canthus of the eye. The maxillary branch is going to give sensation to the middle part of the face up to the corner of the lips, and the mandibular nerve is going to be actually a motor nerve, and it will give us the power or the strength to the muscles of the mastication, and that's how we chew. So you can take 5 fingers and chew. All right. So that is what the fifth nerve does, the trigeminal. The word tri means three, so of course it has 3 branches. Now it also supplies to the anterior part of the tongue. So it gives you the sensation of taste. So the 5 fingers chew and then taste. All right. But only the anterior part of the tongue, so only the front or the tip of the tongue. We don't want to put all our hand in the back of the mouth going to the posterior part. Now move on to the seventh nerve. So seventh is like 7 fingers, right? 7 fingers. And what you do is you put all your 7 fingers on the side of the face, and this is exactly what this nerve does. So the seventh nerve or the facial nerve is going to get out of the parotid gland from the side right here and will branch into smaller segments and supplies sensation to the muscular strength to the motor supply to all the muscles of the face, excluding the extraocular muscles and excluding the mastication muscles. So when this nerve is paralyzed, what happens? Well, you know what happens. All the wrinkles disappear. Well, that's not necessarily a good thing, because then we become apathetic. We just don't have any feelings. We can't show any expressions. And it's kind of in a way maybe a good thing, because then now you can tell if you're mad or not. But then you can't smile either. And now there's a tricky part about this nerve. So you guys probably have heard the word Bell's palsy. What does Bell's palsy do? Bell's palsy paralyzes the lower motor neuron of the facial nerve. So that is the Bell's palsy. And usually happens because of a herpes zoster infection or an idiopathic process. And what it does is it basically affects the motor part or the facial nerve when it has emerged out of the ganglion. It will paralyze that side of the face where the facial nerve is affected. And when you ask the patient to smile or put wrinkles on the forehead, they can't do that. As opposed to that, if it is an upper motor neuron lesion of the facial nerve, which means there is a tumor somewhere here in the brain, then you are not going to get the same picture of paralysis, because the facial nerve is kind of crossing, just like many other nerves, and most cranial nerves actually do cross. So when the facial nerve is crossing, some fibers are escaped from paralysis. So what happens is your upper part of the face is actually spared, and only the droop happens only to one side of the face, and the patient is not going to be able to swallow, the patient is not going to be able to smile, and may start drooling. And it is a very significant clinical finding, because when it happens and it is accompanied by any loss of consciousness or any other central neurologic deficit, then you must think about stroke, because stroke is a very common presentation that involves facial nerve paralysis. The next we'll move on to where we were. Okay, we were on number 8. Number 8 is, well, 4 fingers each side. What do? We put 4 fingers in our both sides in our ears. So what it does is it basically gives us the hearing. So that is vestibulocochlear nerve. It gives us the ability to hear, and also it balances us. So the 4 fingers balance on each other, and that is the vestibulocochlear nerve. The ninth nerve is going to be glossopharyngeal nerve. So that name is very tricky and fancy, and glossopharyngeal, but it really doesn't do too much. What it does is it just applies to the posterior third of the tongue, and we get our taste from it. It gives us a gag reflex. So from gloss, gag. So gag reflex. So we just gag when we tickle this, the uvula or the posterior part of the pharynx, and that's caused by glossopharyngeal nerve. It also, from pharynx, it supplies the upper part of the pharynx. The next would be accessory nerve. So accessory, as the name sounds, which is the 11th nerve, is access. It's like, so many team sports, when we have the 11th player, that is an accessory player. So we have 10 team members in a team, for example, it's cricket. So accessory nerve is going to go ahead and be accessory. But what does it do? It's really powerful. It just makes you shrug. So it's like, what's the deal? It's access, it's accessory. So that is your accessory nerve. It supplies to the sternocleidomastoid and trapezius in the back, and that is why it is accessory nerve. makes you shrug your shoulders. When it is paralyzed, you can have winging of the scapula. So you ask the patient to push against the wall, and then you can see the scapula bulging out from one side, or it's kind of winging out, then it is called the winging of the scapula. So very important test question to remember. The 12th nerve is going to be our the last one. Oh, great. We have come to the 12th nerve. 12th is vagus nerve. So vagus, just like you go to Vegas and you do everything, that's what the 12th nerve does, basically. It supplies to the larynx and the pharynx, and it's a big nerve, and just basically, I don't understand why it is just one nerve, because it supplies so much. It's almost like a monster nerve. It goes all over. So wherever it goes, it supplies there. It's going to go down below the throat, and will go into the thoracic cavity, applies to all the thoracic viscera. Then it will go down to the abdomen, supply to all the abdominal viscera. And you just put your 12 fingers, which you can see I have. Do I have polydactyl? Oh no, I just figured out I don't. So anyhow, so you put 12 fingers right here and right here, and that's your vagus nerve supply. So with this, we finish our cranial nerves, and I hope it was a little bit helpful. Well, if it was not, then I guess you just have to go back and read the book and memorize it all. Can't do so much, too much more than this. Hope you enjoy. Okay, wonderful. Have a wonderful day. Bye-bye.